Cancer is a very scary word. It is an even scarier word when it is used towards a child. Many parents have had to hear this word when their child is diagnosed with rhabdomyosarcoma. Rhabdomyosarcoma is a rare but serious cancer. Rhabdomyosarcoma has certain characteristics and symptoms. It is a fast-growing malignant tumor. It is a type of sarcoma, which is a soft tissue cancer. It is formed from rhabdomyoblasts, which usually develop into skeletal muscles. Instead of becoming striated muscle cells, the rhabdomyoblasts grow out of control. Since this type of muscle is found throughout the body, the tumors can be in numerous places. It is possibly thought to be a genetic factor. However, in most cases, the cause of rhabdomyosarcoma is unknown. According to Pediatric Oncology Resource Center, rhabdomyosarcoma accounts for 5 to 8% of childhood cancers. According to Robin Grossman, this image shows the likelihood of rhabdomyosarcoma occurring at varying ages. 4% of the cases of rhabdomyosarcoma occur in children under the age of 1. 34% of the cases occur between the ages of 1 and 4. This is the most likely age group for rhabdomyosarcoma to occur. 25% of the cases of rhabdomyosarcoma occur between the ages of 5 and 9. 22% of the cases occur between the ages of 10 and 14. And only 15% of the cases occur between the ages of 15 and 21. Rhabdomyosarcoma also occurs in adults, but is very less likely. Symptoms vary depending on the location of the tumor. Symptoms may not present themselves until the tumor is quite large. Symptoms may include a lump or swelling in the arms or legs, a lump or swelling in the groin area or vaginal area, the drooping of eyelids or swelling of the eye, hoarseness or difficulty swallowing, and abdominal pain may occur. There are 3 types of rhabdomyosarcoma. The first type is embryonal rhabdomyosarcoma. Embryonal rhabdomyosarcoma is the most common type of rhabdomyosarcoma. In fact, according to Diane Haley, it accounts for 75% of the cases. It occurs in the head and neck area, bladder, vagina, or in or around the prostate and testes. The second type of rhabdomyosarcoma is alveolar rhabdomyosarcoma. Alveolar rhabdomyosarcoma usually affects older children. It occurs in the muscles of the trunk, arms, or legs. The third type of rhabdomyosarcoma is anaplastic rhabdomyosarcoma. Anaplastic rhabdomyosarcoma is an uncommon type that occurs in adults, very rarely in children. This type of rhabdomyosarcoma tends to grow quickly and requires intensive treatment. According to the American Cancer Society, adults are more likely to have faster growing types of rhabdomyosarcoma and to have them in parts of the body that are harder to treat. Treatment and prognosis of rhabdomyosarcoma are dependent on the location, type, and severity of the tumor. Possible treatment options include surgery to remove the tumor, chemotherapy, radiation, or amputation. Amputation would be most likely if it was in an extremity such as an arm or leg. However, surgery would probably be the best option. Treatment will often require a combination of these treatment options. As far as prognosis, the sooner the cancer is diagnosed, the better the outlook. It is also dependent on where in the body the tumor started, the size of the tumor, whether the tumor can be completely removed or not, whether the tumor has metastasized, the type of rhabdomyosarcoma, the patient's general health and age, and whether the tumor has just been diagnosed or has returned. St. Jude's Research Hospital reports that more than 70% of the children with localized rhabdomyosarcoma have long-term survival. In conclusion, the seriousness of rhabdomyosarcoma is dependent on several factors, including location and type. This then affects the type of treatment that needs to proceed. However, as more is found out about this rare cancer, prognosis and survival chances are more and more positive for children and their parents.